I think all healthcare companies face a lot of challenges today between high turnover and just trying to keep up with all the regulatory and compliance pieces that we have to adhere to. We're a non-medical agency and we have struggled with onboarding people fast enough to keep up with growth and turnover. Just a lot of moving parts there. And then also our authorizations were really kind of a mess. So we have about 1,300 clients today, and it is a lot to keep track of with authorizations. So we had a manual person entering these, a few different manual people over the years, and we'd have transcribed authorization numbers, or somebody would do their math incorrectly. And so we're taking these authorizations, and then we're putting them into our system, and then we're scheduling off of those. So obviously they need to be done timely to start care timely and to avoid billing issues. And just to make sure that we're moving things forward. Our authorization bot has been really helpful in sort of just streamlining everything related to authorizations. So we have 3 different managed care organizations in Iowa. So we are constantly having somebody look up auths that were expired or expiring. What we do is long-term services and support. So we have clients on a consistent basis. They're always changing units or renewing authorizations, all that thing. So we have a lot to manage, and the authorization bot now runs a report for us every day in our practice management system. And then it actually knows which payer portal to go out to based on that information in the report, and then it looks that authorization up, and then if it finds it, it goes ahead and enters it for us, and we get a daily report of exactly what it's done, and then we can kind of divvy that out to our schedulers and our managers to take appropriate action. Our onboarding bot, we're just getting started with, and we are very excited about it. It is essentially making us more efficient with our onboarding. We still obviously need a human to be involved and be the face of our organization and be welcoming and helping our new hires. But it's eliminated a lot of the data entry, and a lot of the data entry that had to occur because we have multiple systems. So we have, background checks are in one portal, and then we have our paperwork in a portal. We've got a learning center. And it was kind of a broken process before because we would have one person kind of checking those things and checking them off and then moving the applicant. Oh, here, now you need to do this. And now that is much more efficient because we have the bot kind of helping us move them through the pipeline and doing a lot of stuff automatically, as well as sending reminders to the employees. So we're not having to hound them. Oh, you made an error on your I-9. We need to fill this out. It's automated a lot of that. It's really going to allow us to then distribute that workload or that time saved elsewhere in the organization. So instead of having one person just spend all of their time on all this data entry and paperwork, we're able to have that person do a lot more things. And then we expect to reduce a lot of just data entry errors with that as well, just like the authorization bot. So we're really excited about it. I think that automating your processes where you can is really beneficial in a lot of ways. Obviously, reducing payroll cost. But on top of that, it really, for our organization, has eliminated a lot of the stress that comes from turnover. When somebody leaves the organization, it's like everybody else has to absorb that role, or you as the manager has to absorb that. And that can get really overwhelming and stressful when turnover is high, and I don't know that turnover is something that's going to be fixed anytime soon in the healthcare system. So we've got to figure out a way to handle it. And also, people just don't stay at jobs as long as they used to either. That's just a normal trend that we're seeing. So everything that we can do to kind of take that pressure off of our managers and off of our office staff so that they're able to focus on actually taking care of our people, the other employees in the field, the clients, that is extremely beneficial, I think, to the culture of the organization as well. I think that CareFlo and Automation Edge, getting rid of busy work has really helped our office staff be able to focus on our people. So our office staff really take care of both our clients as well as our caregivers. They're the ones on the front lines, answering phone calls, answering texts, making sure that everybody has what they need, making sure incident reports are taken care of timely, all the things that occur on a daily basis, call-ins, all of it. And so getting rid of busy work has helped them be able to focus on that stuff that matters, that more relationship type stuff, which I think is very impactful and beneficial to our culture. And then the other thing to note is with our authorization bot, we're able to start clients more timely because we have the bot going out and looking for that authorization every single day, no matter what. Previously, a person had to do that. So obviously there are limitations to that. People get sick, people leave, people get busy, people make mistakes. So it has really improved our efficiency with starts of care as well. Working with AutomationEdge has been really great. And the reason for that, I think, is because they understand the healthcare industry. They understand home care. They understand what an authorization is. They understand, levels of care and turnover in the industry. And so when you're asking them to build something, you're not having to necessarily explain the importance of it. They just get it. And that makes things a lot smoother. I have tried to build software with a different organization that didn't know the healthcare industry, didn't understand home care, and it was a much different experience. So we've been really, really happy with AutomationEdge, and we're excited to, look at all the other things that we might be able to automate or reduce manual labor.